All right. Hello, everyone. Welcome to today's webinar, HIPAA Compliance Check 10 Steps to Protect Patient Data. My name is Gary Tarazian with the webinar team here at Rectangle Health. We appreciate you taking the time to join us today for this month's HIPAA compliance training. And before we get into it, some housekeeping items. This is a 1 hour course valid for 1 CE credit. We are a PACE provider for CE through AGD. In order to receive that CE credit, you must attend this webinar for the entirety of the presentation and participate in the 2 polling questions. Please allow for up to 2 weeks to receive that CE credit. That will come via email. And then within 24 hours of this webinar, I'll be sending over the recording and links to upcoming no-cost CE credit webinars, as well as more details on how your practice can achieve and efficiently maintain compliance, leveraging the right solutions. If you're joining us on mobile, as always, the experience is better on desktop and easier to reply to the polling questions. If you'd like to take a second to log back in from a computer, you could do that now. And while we wait, folks, I see many of you have already completed your HIPAA gap assessments prior to this webinar. It's that questionnaire that was linked to in the email invites for registering for this webinar. For those of you who did, congrats, you're on your way to resolving those vulnerabilities that your practice may have, preventing costly penalties and fines due to violations. For anyone who did not have a chance to complete that gap assessment, I will drop the link to it in the chat as soon as I pass the mic over to our speaker. And now, without further ado, it is my great pleasure to introduce Leanne Holloway, Senior Practice Solutions Consultant here at Rectangle Health. With over a decade of experience in the healthcare space, she specializes in HIPAA and OSHA compliance, patient engagement, and payment processing, helping healthcare practices stay fully compliant while improving efficiency and revenue. Leanne takes a proactive approach to compliance, so offering custom compliance programs, staff training, and streamlined documentation to ensure practices meet and exceed regulatory standards. And her deep expertise in merchant services and payment integration further simplifies practice management, ensuring secure, compliant transactions and financial success. Dedicated to helping the healthcare providers maintain the highest standards of compliance, Leanne has helped equip practices with the tools and knowledge needed for ongoing regulatory success and operational excellence. Leanne, thanks so much for taking the time to host this training. Take it away.
Appreciate it. Thanks, Gary. Well, thank you everyone for joining us. I appreciate it. And that was a mouthful what he said. I hope I can live up to those standards. But let's kind of start off with a little about myself. Again, I am Leanne Holloway, Senior Practice Solution Consultant here at Rectangle Health. Yes, I have long time, I guess. We're going to say over a decade, years in the medical and dental world. And boy, has a lot changed, as you all know. Things have changed with patient care, and you guys have been the first in line to see that. One, I personally want to say thank you so much for everything that you all have done, especially in the years that have happened, because you guys have gone through a lot. So hats off to you for sticking with it and staying and helping all of us and making sure the quality of patient satisfaction has been top notch. But one thing that's changed a lot is technology. Not only, our lovely self-driving cars, but same-day crowns, telehealth visits, text-to-pay reminders. And, you can just get in on the same day, where a lot before you had to get without a cell phone, as my kids say in the olden days. You had to pick up that phone and just make a call, and hopefully you didn't get a voicemail. So, but however, with great innovation comes great risks, okay? And I'm sure everybody understands that. Today, we're going to dive, as you see here, we are going to go ahead and dive into the dark corners of compliance. These dark corners are where the cobweb-covered HIPAA binders are tucked away in the closet. You all know what I'm talking about. Post-it passwords are taped to monitors. You other people know what I'm talking about. and staff who lurk in the shadows are calling patients' names like they are contestants on The Price is Right. Hey, John Smith, you're next. Have you ever kind of thought about those type of things? All right, I'm a little dramatic right now, but the stakes aren't. 2025, honestly, is turning point in enforcement. HIPAA is no longer just paperwork. It's real consequences, massive fines, and above all, your patient's trust. You worked hard to gain that trust. We want to keep it. Audits are tighter. Penalties are bigger. Cyber attacks are everywhere, and they're coming for you. Small and mid-sized practices are no longer under the radar. You're now in the crossfire. Okay. Can your practice afford to sit this one out? No. But I'm not here to make HIPAA dark and gloomy or scare the living daylights out of you. I'm here to shine a light on chaos, give you the tools and knowledge to take back that control, and maybe cringe just a little bit less when someone says HIPAA. Let's move on to our agenda. So today we're going to go ahead and talk about how you're going to know what the new rules are for 2025. Security risks, hugely important. Train like you mean it. Control access like a fortress. Encrypt everything. And again, yes, I do mean everything. Build a breach response plan, emergency response plan. Secure your Wi-Fi. Ditch those sticky notes. Review your business associate agreements. And above all else, don't go it alone. Excuse me, I apologize. So let's move on. I'm not one who likes to read a lot, but I do feel like this is probably really important that you actually understand and know what the new rules are, what are the proposals are out there for the new rules in 2025. NPRM, Notice of Proposed Rulemaking, HHS has proposed this, and we're pretty sure that it is going to be coming out this year. For the first time, required written documentation of those roles, completed and defined responsibility and authority. All security rule policies, procedures, plan, and analysis must be formally documented, which explicitly includes naming and empowering these officers in writing. No questions asked. The NPRM also mandates that all existing implementation specifications be elevated from addressable to required. I'm going to say that one again because this is probably one of the biggest things. Mandates that all existing implementation specifications be elevated from addressable, which is what it is now, to required, with very limited expectations. And that definitions be revised to encompass today's cyber threats. Practices must maintain and update at least annually written policies and procedures that specifically address hazards, ransomware, phishing, and other malware attacks. OCR, Office of Civil Rights, is sharpening its focus on individual rights to access and understand how their electronic patient health information, EPHI, is used and disclosed. So beginning in 2025, practices should expect stricter enforcement of patient accesses request and may need to furnish more detailed logs or disclosures of PHI sharing, in line with border federal moves towards interoperability and radical transparency. Under the proposed changes, business associates and subcontractors must notify covered entities without reasonable delay, but no longer, this is the clincher, 24 hours after activating contingency plans or discovering a security incident. This is dramatically shortening what it is now because it's currently at 60 days. All right, the rule prescribes a far more rigorous risk management framework also. Annual technology assets, inventory, and network maps, updates also in response to any change that could affect EPHI, written risk analysis and identity threats, including ransomware, vulnerability, and access both the likelihood and impact of each. Formal incident response plan, tested and revised at least annually. The technical controls, malware, port disabling, deployed consistently and reviewed yearly. These steps elevate digital risk management from the best practice to the strict requirements. So, with all these new rules, HHS has not changed the security policy since '96. That is a long time. So I know I went through a whole lot. We're kind of going to touch on some of these in the next few slides. One of the biggest ones is your security risk analysis. Okay? Because guessing does not count. This is the number one thing HHS asks for if there's a data breach or even a complaint. HIPAA loves documentations, okay? And the risk assessment is the golden rule of HIPAA, if you want to think about it that way. If you don't have a current documented risk assessment, or what we like to call SRA, you're already out of compliance. Your HIPAA security risk assessment isn't just a formality, it's your compliance foundation. It identifies where all your vulnerabilities are. Think of a HIPAA risk assessment as a comprehensive, let's use dental or medical exam for your practice data health. Without it, hidden problems go unnoticed, okay, until they become painful or honestly extremely expensive. Saying we did, oh, you know what, we did one last year. One, that doesn't cut it any longer. A risk assessment is required to be completed annually, okay? But it also needs to be updated. That's where a lot of the offices make mistakes. I did one back in January, or I did one back in November. But if you change certain things, like your EHR, your PMS system, remote staff has access now. You switch payment platforms. Any technology that has changed, you have to update it and you have to change it. Okay. And yes, you have to write it down. You can't just talk about it. If you can't produce documentations, basically like, is your Wi-Fi secure, let's per se? Are your passwords secure and updated? Or that you have you completed your security practice scans? Honestly, it's like it's never happened. So in your practice, let me ask you, let's jump to like a dental office. Let's just say somebody comes in, you do their x-rays, you find out they have small cavities. Would you let those tiny cavities go untreated until it becomes a root canal? Don't let small vulnerabilities fester until they're turned into a data breach. A thorough, regular dental exam of your practice system is the best way to keep your PHI healthy and honestly HHS away. And that's kind of what we are all looking to do, okay? All right, let's jump to the next one. Train your team. This is another one that is absolutely huge. So train your team like you mean it. Because I'm sure you've heard this before. The weakest link always opens the door. Think about that for a second. The weakest link always opens the door. Technology will fail, but people can be trained to spot risks, but you have to invest the time in them. Training is huge. However, HIPAA doesn't want shared. It wants accountability. Someone from your practice needs to be the point of person, the only one who knows the rules, monitors the update, organizes the training, and most importantly, takes responsibility when something slips through the cracks. This person is called, excuse me, this person doesn't have to be a compliance attorney or a full-time watchdog. but they do need to know the HIPAA requirements, understand how your practice stores, accesses, and shares their patient data. Lead your annual risk assessment and make sure staff are trained and retained regularly. This is called your compliance officer, and each office has to have one. So if you don't clearly have a person assigned and trained, the government considers that a red flag, okay? It's like trying to, let's just say it's like trying to steer a ship in a storm with no captain. So make sure you have the captain of your office. Now, all right, so now that you have your compliance officer, what about your staff? HIPAA training isn't a one and done checkbox. The rule is clear, all right? Training must happen annually. New hires need to be trained immediately. And the HHS, their proposal has it out that new staff members must be trained before they even have contact with any type of PHI, patient health information. And yes, it must be documented. They must be documented. They must have who attended, what was covered, and when did it happen. All right, let's go over some of the things that they need to cover. Protected health information, your PHI. Show real examples, paper charts, screen captures, even overhead conversations. Business associate agreement. Make sure every vendor relationship has a signed business associate agreement. Review privacy, security, and breach notification rules in plain English. Patient rights. Teach each team member the rights to access, amend, and account for disclosures so they know when to pause and when to escalate. Security best practices. Run monthly phishing simulators. Enforce password hygiene and workstation clean up before it breaks. Okay, we're gonna jump into that one a little bit later, but employee attestation, I'm gonna say it's gonna cover. We're going to go through that. But the policies and procedures here, you want all your employees to know all the policies and documents. Print them off, let them read them, sign them. It doesn't have to be done like in one day. You can do this throughout a period of time, but it's important for them to know what is in that binder. So your team is your first line of defense, all right? Don't leave them guessing and don't assume that they already know, especially even ones who have come from another office. They need to be trained also because they're in a different office. All right, Gary, I think we have a polling question coming up. We do.
Yes, we do, and it should hit your screens right now. Which of the following must a practice employee learn during HIPAA training? Is it patient health information, security reminders, patient rights, or all of the above? We'll give everybody a second here to respond. And folks, while you're doing that, I did drop into the chat of this call Leanne's email information so that you can feel free to send her any and all questions that you may have regarding the presentation, specific compliance questions directly to Leanne, and she will get back to you after the recording and after this session is completed. I've also included a link to the gap assessment in case you haven't completed that yet. Um, and looks like results are coming in. I'm going to end the poll here and sharing the results. Leanne looks like 3% said patient health information, 1% patient rights, and all of the above 96%. So what's the right answer there?
The right answer is all of the above. However, I'm going to say everybody is correct because anybody who puts any one of the answers, you are correct. So kudos to every single one of you for answering the correct answer. So let's kind of move down. We're going to go ahead and we're going to talk about lock down your device and data. If it moves, it's a target. Okay. Encrypt every device right here. That includes phones. I've talked to 100 million offices. Again, you know, I'm exaggerating a little. We talked about that at the beginning. And I have multiple offices who are still using their personal cell phones to text people. We can't do that. Because this includes texting used for texting patients, laptops taken home by staff, and tablets used to intake forms. If it's stored or accesses patient info, it should be encrypted. Unless you're encrypting your phones, which I'm not sure how, those cell phones, don't use them. Cloud storage and backup systems. Just because your data is in the cloud, doesn't mean it's automatically secure. Make sure your vendors are HIPAA compliant too. And we're going to go over that in the business associate agreements in a little bit. Use strong passwords and multi-factor authentication. Trust me, it's a pain, I know. We get it all the time in this company, where it's like every 2 months or every 3 months, we're always having to change a password, and you're like, oh my gosh, I can't remember them all. But it's very important, especially nowadays. Mobile equals convenient, but mobile equals risk. In the eyes of the regulators, unsecured mobile devices are one of the fastest ways to fail an audit or land on the breach list. We definitely don't want anybody to do that. Auto lock screens. After a few minutes of inactivity, make sure you shut down those screens. You would be surprised, and I'm sure each and every one of you guys have seen this before. I've walked past an open, it's not her screen, it's EHR, but I'm going to say her screen because a lot of times it's been like myself included before, while the provider, nurse, or front desk is down the hall. Easy way for somebody to go ahead and hack, okay? So make sure these things are taken care of and under control. All right, let's jump into the emergency incident response plan, or breach response plan, people will call it, before you actually need it. A lot of my clients, honestly, friends, I'm going to call them because that's what they are. No, I do real talk. I shoot from the hip. I tell it how it is. Data breaches are no longer an if, it's a when. And when it happens, the clock starts ticking now, right away. Under HIPAA, you have no more than 60 days to notify patients now. The Department of Health and Human Services, and in some cases, the media. If your breach is over 500 or more individuals, which is easily to be done, especially in your whole patient database, it's going public fast. So what do we need to do? Back up that data plan. Okay, data backup and have that plan. Assign ownership. Schedule automated on-site and off-site cloud backups. Define your recovery point objectives. Hourly for critical, daily for others. Do an incident flow detection. Detect, classify, containment, notification. Internal stakeholders first, then OCR, and patients within required window. IT recovery, make sure, define recovery time objectives for each system. Establish failover processes and validate backup integrity regularly. That's huge. Testing and revision. Run tabletop exercises quarterly and full failover drills annually. After every test or actual incident, update your plan based on lessons learned. Okay, I apologize, my mouth's getting dry. But don't forget, like even small incidents, okay? Sending an email to the wrong patient can be a breach. If you don't have a plan, you'll waste vulnerable time trying to figure out it on the fly. Okay, That delay could cost you fines, lawsuits, and honestly, sometimes the most important, trust. Okay. If your current plan is if your current plan basically is, happens and you already have it all completed, you're going to go to that plan and you're going to be able to go ahead and take care of the situation on the fly right there. All right, let's break it down for a minute. Let's have a little fun for a second. All right, it's time to play Let's Bust the Myths. All right, I'm going to give you a little example. We're only going to do a couple. Now, I want everybody who's at home, in your work, if you're having lunch, whatever, we're going to read the question together. And then I either want you to yell out, heck nah, or heck yeah. All right. I updated my HIPAA binder when I remember, every few years. What is it? Heck nah. Constant training, updates, and always working at being prepared can help keep HHS away. You're right. Heck yeah. I am a small office. Nothing will ever happen, or nothing has ever happened this many years. I am good. Hear this all the time. What do we say? Heck nah. Good job. Thanks for kind of entertaining me on this one. All right, so let's jump back into it. Know exactly where your patient data lives. You can't protect what you can't see. So here's the harsh truth. If you can't map out exactly where your patient data is, how on earth are you supposed to secure it? Patient data isn't just stored in your EHR system. It's in emails, paper files, cloud storage, mobile devices, and sometimes even an old backup drive that you forgot about in a drawer. I had an office one time who had a basement, and they had an old desktop that they put downstairs in wherever they kept all their storage. They ended up having a breach, but it was on that desktop down there. So no matter what, you always want to make sure. And the biggest thing is, it's super simple. Inventory, inventory, inventory. Okay. Where is every piece of patient data stored, accessed, and transmitted in your practice? Is it on your computer? Is it sitting in your email box? Is it in a file sharing system? Is it printed out and left on somebody else's desk? Is it in a filing cabinet? Once you know where it is, you can start protecting it. Encrypt, encrypt, encrypt everything. Limited access to only those who need it. So, for instance, your front desk doesn't need to have access to certain things your doctor does. Make sure your vendors, billing companies, labs, anyone with access to patient data are compliant too. Okay. And again, look over this. Is it in your file? Is it in your file system? Is it printed out and left on somebody else's desk? Is it on your computer? Is it sitting in your email box? Encrypt everything. Okay. Now, one of the biggest things is you want to also monitor your systems, because it actually can happen to you. Excuse me. I apologize. So listen, the work doesn't end when your system is up and running. In fact, that's just the beginning. Just as you see here, cyber criminals are like tides. They're always coming in, always searching for vulnerabilities. Ransomware attacks are becoming more sophisticated day by day. And if your system isn't constantly monitored for unusual activity, You're playing with fire. So what can we do about this? Implement continuous system monitoring. So you know if someone is trying to access patient data, whether they're authorized or not. Set up alerts for suspicious activities, failed logins, large data transfers, or unexpected access to sensitive data. These are red flags you can't afford to ignore. This isn't just about IT support either, okay? It's about having the right tools in place to spot anomalies in real time. Are you logging who has access to patient data? Are your logs being reviewed regularly? Don't forget, documentation is key. So every time a suspicious activity is flagged, document what was done to address it, and that will be your proof in case there is an audit. All right. I hope everybody's still with me. So now we're going to start backing up our data. All right. I know a lot of people have the cloud. We talked about this, but because one had, I apologize, my mouth is super dry. Back up your data because one hard drive crash basically could mean your practices end. Imagine this. It's a busy Monday morning and your entire practice data, your patient records, billing information, everything just disappeared because the server was crashed. A cyber attack happened. Or there was a natural disaster that actually took out all the systems and hit your office. What happens then? Let's think about that for a second. Before that could ever happen, here's what you need to do. Back up all the patient data regularly and test those backups. A lot of you, I already know, I'm already saying things that you know because you probably already have backups. You're already doing that, but have you tested those? Use offsite or cloud-based backups, which a lot of you already have. But are you making sure they are tested? And always, always, always encrypt your backup. Moving on, stay on top of third-party vendors. This is where a lot of people fall short. Okay. So stay on top of third-party vendors because if they fail you, you fail. Your compliance ecosystem not only is in-house, but it extends beyond your walls. So here's the truth that is often overlooked. Your third-party vendors, billing companies, IT, support labs, cloud storage providers are all extensions of your practice. Your patients aren't looking at them, they're looking at you. If they drop the ball on HIPAA compliance, you can also be held responsible just as they are. So under HIPAA, you must have a business associate agreement or BAAs with every vendor who has access to your PHI, your patient health information. This isn't optional. This is a mandatory thing that HHS requires. It's not about signing a piece of paper either. It's about making sure they are actually meeting the same stringent security standards that you are. So go ahead and review your BAAs at least once a year to ensure compliance. Does your vendor's security meet HIPAA standards? Are they on top of their data protection measures? Ask for regular audits. I'm sure they'll love that, but ask for it. Or reports from your vendors about security practices. They should be able to show you their own efforts to protect patient data. Stay in constant communication. That is huge. Your vendors, you're paying your vendors, you might as well make sure you get all these information. A lot of practices forget to stay on top of their vendors' compliance. So let's kind of go over to Gary for a second here, and then I'm going to show you a business associate, the BAA. Next polling question, Gary.
Some thanks, Leanne. The next polling question should hit your screen right now. Who are considered business associates? Your IT provider, your PMS or EMR systems, your email marketing platform. We'll give everybody a second here to answer. And just again, while that's happening, a reminder, I have a link for you all to connect with Leanne on LinkedIn, her email address for any questions. If you'd like to speak to Leanne one-on-one in through an extended period of time, there is a link to a form that you could submit to discuss your practice's compliance needs. It looks like the results are still coming in a bit, so give it another second here. All right, gonna end the poll and share the results. Looks like 39% your IT provider, 55% the PMS or EMR system, and 6% your email marketing platform. Leanne, what do we got?
Dun, 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 dun. It's all the above. So that kind of was a trick question. Again, everybody who has access to your patient health information has to have a business associate agreement. It's huge. Let me show you. So here's the business associate agreement. And again, the definition, a business associate is a person, entity that performs certain functions or activities that involve the use or disclosure of protected health information on behalf of or provides services to a covered entity. And you are considered a covered entity. So as you see, yes, all of these individuals must have a business associate agreement. They're not too hard to do. It just has to be done. Unfortunately, HHS, it is one of those requirements. If you have any questions, again, we can talk about it. You can email me. I can answer any of those questions. Let's move on because of time. I wish I could go into more about that, but let's talk about what with HIPAA, if you're not growing, you are falling behind. Embrace continuous improvement. If you're not growing, again, you're falling behind. With everything that we have discussed, I want you to think about this statement. Stop treating HIPAA like it's a binder. You're probably like, what the heck, Leanne? Again, stop treating HIPAA like it's a binder. HIPAA isn't a binder. It's not something you check off and just file away. Remember those little cobwebs? HIPAA is a living, breathing system. One, it's how your team communicates. It's how your data is stored. And it's how your patients are protected. Huge. If there's one thing that's certain in healthcare, it's that things never, ever stop changing. And all of you understand that better than anyone in this, anyone, myself, anyone, and I've been in the industry. HIPAA rules, security standard, and even common threats evolve faster than you can blink an eye. Ransomware is getting smarter. Audits are getting more frequent. And if you're not staying ahead of the curve, you're going to quickly find yourself scrambling to catch up. Attend regular HIPAA and security trainings. Read up on the latest compliance updates. And most importantly, network with other practices and work with experts who actually know what it's all about. So now, first, congratulations. You've navigated basically through the shadowy halls of this HIPAA without accidentally exposing any single X-rays or shouting out patient chart numbers into the waiting room. Now, no, really, I do. Give yourself a hand, because if you're a dental office, then go ahead and give yourself a glove, fist pump. But the one thing I do want you to remember, compliance isn't that rusty old binder gathering cobwebs in the back of the office, okay? It's your protective gear against nightmares like hefty fines, unexpected audits, And we already know, because we know that dental offices and a lot of medical offices keep posted in business, but it's those post-its stuck to your patient intake forms or an account number written on those post-it notes. Go ahead, retire that dusty binder, maybe shred it in some sterilizer, and swap it out for a living, breathing compliance program that evolves as fast as your next new piece of equipment, okay? Because compliance isn't just about avoiding trouble. It's honestly about safeguarding your patient's trust, empowering your hygienist and your front desk team, and protecting them, the practice that you have drilled, sutured, and staffed to perfection. So I'm going to tell you, go forth, keep those auditors on their toes, show that ransomware there's no match for your type of defense in the defense that you're getting ready to do. And if you need a partner in your compliance crusade or need help with anything, whether you're filling cavities or charting vitals, you know where to find me, right here at Rectangle Health. All right. Thank you for joining me today. Stay sharp, stay compliant, but most importantly, stay amazing. Back to you then, Gary.
All right, Leanne, thanks so much for a great presentation. Folks, that concludes the CE portion of this webinar. Before we wrap up here, just a few reminders and housekeeping items. CE credits, again, will be emailed to you within 2 weeks of today. Be on the lookout for those. Um, they will be in your inboxes. Uh, the email address that you registered for this webinar with. Um, be sure to check your spam and junk folders right within that 2 week range. When this webinar ends and closes out, you will be prompted to complete a survey. Please take a few minutes, share your feedback and thoughts on today's presentation. Every response is closely reviewed so we can enhance the webinar and CE experience for you all. And as a reminder to complete those gap assessments, if you haven't already, the link is in the chat. And if you'd like to schedule a call with Leanne to discuss HIPAA compliance at your practice further, that link is also in there. We're just going to take a few minutes here. I'll pass it back to Leanne before we close out to do a really quick overview of the HIPAA gap assessment and our bridge compliance tool. Leanne, back to you.
Appreciate it. All right, I'm back again. Thanks for sticking with us. But so if anybody has had, like, I piqued your interest a little bit in simplifying your compliance program, or basically you just like, a helping hand, seriously. You, like Gary said, you have my email at the bottom. Okay, but you should have gotten this gap assessment in your email. Okay, but if it hasn't arrived yet, don't worry, because either email me or one of our specialists, who are amazing, will be reaching out to you, and they can help you complete it if you do need help. And then they'll probably send you over to myself. If you just like to prefer, like I said, to talk to me directly, Gary's put my email in there. What we have here at Rectangle Health is amazing. This is why I love compliance so much, is because how easy our platform is. HIPAA isn't easy. In fact, it's quite daunting, to be honest, but it's necessary. All right. So if you would love to see this, please fill out your gap assessment, find out what vulnerabilities you have, and go ahead and reach out to me. But again, thank you all for joining us, and I look forward to talking to you all soon.
Thanks again, Leanne, for a great presentation. Um, Folks, again, reminder, please complete that survey at the end of this webinar. Follow the links to contact Leanne. I will be sending out the recording shortly after this webinar concludes. Thank you once again for joining, and have a great rest of your day, everybody.